afternoon, everyone. Welcome back here in our live studio at ESCMID Global 2024 in Barcelona, Spain. My name is Judith Cohen, and I am very pleased that I have two guests here in my studio right now at the moment who are going to talk to me a little bit more about pediatric infectious diseases. This is a very important topic. I have Professor Julie Toubiana. You are a professor in infectious diseases and also a pediatrician working in the Necker Hospital in Paris, France. And you are also a member of the program committee for ESCMID Global. Exactly. So warm welcome to you. And next to you is one of your co-hosts for the Meet the Expert session that you will be hosting tomorrow, Dr. Sanjay Patel, pediatric infectious diseases and immunology consultant. I start stumbling at the end of the afternoon.
Judith, I have to admit, it's not easy to say that all in one go.
It's a mouthful, yeah. But you're from the University Hospital in Southampton in the UK, so also a very warm welcome to you too. Tomorrow, as I have been told, you will be hosting a Meet the Expert session in Hall G at 2:45 for our viewers who get triggered by these interviews today. You can still join maybe tomorrow. The topic is pediatric infectious diseases. So Julie, you as a pediatrician, I can obviously see where your interest comes from because you're also a professor of infectious diseases. Is it a topic that has not had enough attention? Is there a huge unmet need in pediatric infectious diseases? Could you comment a little bit on that?
Yeah, well, pediatric infectious diseases start to grow, obviously, and what is important is that there's a communication between adult and pediatric infectious diseases and also microbiology. So I think that this ESCMID Global is really the opportunity to share our experiences, our expertise also about pediatrics. I think this is a good opportunity this year.
Yeah, Sanjay, why is there an increase in pediatric infectious diseases?
Well, I mean, I think just going back to what Julie said, I mean, the first thing is that children are not just little adults. So that we're so pleased to be here because you can imagine if you look after people of all ages, you go from giving advice on a neonate who might be a premature baby who's 22 or 3 weeks gestation all the way up to a 105-year-old. And I think lots of our colleagues in microbiology and pharmacy feel much more comfortable with adults than they do children. And so one of the roles we have, and we work within ESCAP, which is the one of the study groups within ESCMID, and we work within ESPID, which is the European Society of Paediatric Infectious Diseases. But it's so important to get some of those messages about how children are different to adults and to build the confidence in our colleagues who are looking after these children or giving advice on those children. So that's why we're really keen to be here and run our session tomorrow.
Yeah. Would you say that it's fairly well known that medication or antibiotics work differently in children, but we're not sure about how infectious diseases themselves act in children differently from adults?
I think that our adult colleagues are brilliant at the bugs, so they know their Staph aureus and their strep pneumos and stuff, but they're less confident in the presentation in children and the complications in children, and often they're more risk averse. If you're not as confident with a group, a patient group, you tend to treat for longer, you tend to do more tests, and actually that's what our role is to just convey that messaging about how an infection presents in a child, what the limitations of diagnostics are, timings of IB to oral switches, all of those basic tenets of antimicrobial stewardship. That's kind of some of the big messages that people will hear about tomorrow if they come to our session at 2:45.
Yeah. And also the fact that most adults are very afraid of pediatric infectious disease infections in pediatrics, and would like to share with them that it's not that complicated. We just have to know what are the differences, but also what are the common way of treating patients, pediatric or adults, and you have some common issues that we can share too.
Why do you think it is that adults are scared for small children getting infectious diseases? Because small children can get really sick, right? Do they get more sick than adults, or is it just a different presentation?
I mean, both different presentation, and also, yes, also of course, young children are very precious, and we are afraid of doing wrong. They have a whole life after the first years, and so we tend to do as much as we can, and sometimes we do too much. So regarding antimicrobial stewardship, this is very important, because some of my adult colleagues would give the largest antibiotic regimen because they are afraid to make a mistake, which won't be right for the future of the child and to protect his microbiome.
Yeah, I can imagine that there's easily an inappropriate prescription of antibiotics in children, maybe even more so than in adults. Do the numbers support that?
I think the repercussions are greater. I mean, you go back to the microbiome. If you meddle with the microbiome in a newborn baby, it's so much more likely to have an impact long term, more of an impact than if you're giving antibiotics in adults. I mean, I think lots of the narrative in adults is about antibiotic resistance, isn't it? In children, you've got to think about the microbiome as well. So there are just little nuances, but there's still lots of similarities. I think we just want people to be less scared of looking after children, to use those same basic principles, and we're just here to build that confidence.
Yeah. Well, that will be helpful at least. What do you feel is the key issue within pediatric pediatric infectious diseases? Is it the inappropriate antibiotics, or?
Well, I think there's a more fundamental problem, and it's almost the recognition that you need experts in pediatric infectious diseases. So I think we often find that it's very hard to advocate for children. So much work is done with adults, especially the frail and elderly. So many resources, staffing-wise, and our hospitals stack their systems towards adults that children are often an afterthought. And so I think one of the greatest challenges we find is, why do we not have those same structures and the same funding that goes into pediatric infectious diseases, pediatric antimicrobial stewardship, pediatric OPAT, that kind of goes into adult services? So that's a major issue. And then we have lots of the similar problems to adults. Antimicrobial resistance is a big problem in children.
Absolutely.
I mean, many people think, God, it's got to be adults because they have loads of courses of antibiotics. They've got all these comorbidities. But you just have to wander around either any of our pediatric wards in the Necker or in Southampton, or our pediatric intensive care units, or even our neonatal units, and you'll find a whole load of babies and children with highly resistant infections. And we've seen this evolve, Julie and I, over the past 5 to 10 years. We have more and more and more very hard to manage infections in children, where our availability of antibiotics and good knowledge about PK and PD is limited. So it's becoming increasingly challenging, which is why we take AMR in children so seriously, because it's hard to manage.
Yeah, so there's definitely a need for more awareness that you don't have to have had a lifetime of antibiotics before running into the problem yourself as an individual of having a drug or multi-drug resistant bacteria.
Yeah, I would add that because of the advances of medicine, even in pediatrics, the patients are more and more complicated, and we're using a lot of immunosuppressive drugs. There are a lot of different new issues now, and we need to take into account this. And so we really need the expertise now. It's not like just community infections. It's also very complicated healthcare infection that needs to be treated. So it's a great challenge. And I would add also, specifically for children, you also have the vaccination. So we have a lot of vaccine preventable disease that are almost specific to pediatrics, and or the severity is specific to pediatrics, and vaccine is very important. And so as pediatrician, we are very aware of that and very into vaccination. So this is also.
Could you give an example of one of these infectious diseases? Is it the ones that the vaccines are already available for, or are you referring to a need for new vaccines for new?
I would say both, yes.
Okay.
Well, I work also, I'm working on AMS, but also I work on pertussis disease. And I'm part of the National Reference Center of pertussis in France. And we are facing now a very big issue after COVID of a growing number of cases of pertussis. Despite vaccination, we have available vaccine, and they are efficient, but they are not efficient in a long period of time. We have this waning immunity, and this is very challenging because the young children, less than 2 months, are too young to be vaccinated, and they got the disease from the elder parents or older children, and so we also need to be aware of that.
Yeah, I can imagine that's a large problem. Yeah, Sanjay, how are you looking at this topic?
Well,
because in different countries, it's probably different also, the amount of people
that
are willing to...
It's so similar between France and England. I mean, Julie and I, this is the beauty of having a network of people. You can share ideas. So just before we came on air, we were talking about their management of endocarditis. There's been a great session this lunchtime on endocarditis and how we switched to oral antibiotics earlier. It's something in England, in paediatrics, we haven't embraced so readily, but Julie and her colleagues are doing this in France. So, you know, it's brilliant to network. It's brilliant to share good, and that's what we're doing through a network that I chair through ESCMID and ESCAP. So we've set up a Europe-wide antimicrobial stewardship network so that leads from every country in Europe come together to kind of identify how you can advocate for children, what I was talking about earlier, that we really struggle to get those the funding and the recognition that's required. But also good practice in France can then be shared across other countries. Good practice from England can be shared and vice versa. And that's kind of such an important part of a relatively small specialty, which is a specialty. And going back to what Julie said, I mean, Paediatrics has transformed in the last 10 to 15 years because of the advances of modern medicine. So I think even more so than adult medicine. So adult medicine, say life expectancy has gone up from, say, 75 to 85 in the last 10 years. It's gone up by about a year every year in high-income countries. There's a whole cohort of children who would not have been alive 10 years ago who are now, because we have non-invasive ventilation, we've got ever more sophisticated intensive care and neonatal units. And all of that knocks on to people like us because they get more and more complicated infections. So I think we share more similarities, definitely between France. I mean, our colleagues in lower middle-income countries, much more difficult. And there they don't have the diagnostic resources we have. They don't have the antimicrobials we have. They don't have the structures in place. You know, I can lament the fact that we don't have many PEDS ID people and much resource for stewardship, but they have almost nothing in some countries.
No,
so
that adds hugely to the complexity of the problem.
But so collaborating with them, which is what we do, and we've just been talking to colleagues from Latin America just now about expanding the ESCMID antimicrobial certificate, which is something that ESCAP set up a couple of years ago, expanding that into South America and Latin America, and we'll work with pediatric colleagues there to set up a special a pediatric course, hopefully based out there. So, you know, it's all collaboration. We like to collaborate as pediatricians, don't we, Julie?
And we like to discuss, and sometimes we don't have the same local guidelines, and we don't agree, and I think that's the expert session would be about. So
you might see us disagree tomorrow afternoon.
And
it's about sharing the best practices, learning from each other, Do you feel that there are enough people, globally maybe, with expertise in this field of area, or this field? Because you're saying, well, we need to advocate for the children, we struggle with funding, we struggle with awareness that
I think
children
the
are not just small adults.
There are not enough people in this field. So if you map the number of people with expertise in managing children with infections, so pediatric infectious diseases and immunology. And it's important to remember that young children who get severe infections, it might be because their immune system doesn't work, and that's why we specialize in that as well. But the growth in the number of people doing that has not matched the growth in the number of children with positive blood cultures, resistant infections, the ever-increasing group of immunocompromised children or children with severe disabilities. So I think the demand has outstripped supply, unfortunately, in this case. And that's what we're trying to advocate for.
Yeah. So you're looking forward to meeting other people tomorrow that are hopefully like-minded. Yeah, and working on pediatrics. Wow, this is wonderful. Thank you so much for both taking the time and the effort to come here and give us just a little background information on the complexity of pediatric infectious diseases. And I hope this will attract even more people towards your session tomorrow. So you have at least a large enough network to get some things done already this ESCMID Global. Thank you so much, Sanjay and Julie.
Thank you.
And thank you for watching us. We will be back at 5 o'clock sharp, and we will be back with two of the speakers of an educational session that is being held tomorrow morning at 8:30 on the rapid detection of antibiotic resistance, state-of-the-art session. So tune in with us at 5 and join us for more info on that. See you then.